Many cancer patients are treated with surgery to remove the tumour, followed by chemotherapy to kill any remaining cancer cells if present. However, not all patients have remaining cancer cells, nor the same risk of their cancer recurring after surgery. We are trialling a blood test called the circulating tumour DNA test that looks for DNA released from a patient's tumour after they have had surgery. The presence of tumour DNA in a patient's circulation after surgery is a sign of remaining cancer cells. We want to know which patients are at risk of recurrence and need to start chemotherapy to give the best chance of survival. For patients who are at a high risk of recurrence, we can give them a more intensive dose of chemotherapy than those with a lower risk of recurrence. We would also like to be able to tell some patients that their cancer is unlikely to recur so that they can safely avoid chemotherapy and its harmful side effects.
The suite of trials began in 2015, and we have already shown that the circulating tumour DNA test can identify which bowel cancer patients are at high risk or low risk of recurrence. We have now extended the trial to ovarian cancer.
My name is Anne, and I was diagnosed with ovarian cancer early this year on the 2nd of January. My treatment was surgery and followed by chemotherapy. There's good days and there's bad days. It's not always fabulous. Hearing the word cancer is a complete shock. We very quickly had to get our heads around the fact that treatment was going to take several months and a recovery period where I may not feel as fit and able as I'm used to. So that meant that we had to put overseas travel plans on hold. I joined the trial because I have a daughter. Also my boys, my two sons, have partners, and I'd like to think that we could assist there, that the trial would remove them having to go through a lengthy process, surgery and chemotherapy, and for all women, for the benefit of all.
In the future, I hope that we can safely and reliably determine each individual patient's risk of a recurrence. If some patients can avoid chemotherapy, it will be a huge improvement in their quality of life. We also hope that by identifying patients with the highest risk of recurrence, we can give them intensive chemotherapy to give them the best chance of a cure and of improving survival. The ctDNA test could be an important step towards personalising cancer treatment for individual patients.